Good evening, everyone. We are here with yet another virtual session. Today, we are here with Veronica. She is pursuing MSc in Applied Psychology and she is specializing in the counseling psychology. She is she is studied in the Francis Degree College for Women in Hyderabad, Telangana, India, and she published a research paper in the International Journal, and the title of paper is a comparative study of parental acceptance, rejection sensitivity, and empathy in adolescents belonging to military and civilian families. She is working on another research as well, and she has certification in project management and HR management. She also holds the diploma in intellectual property rights and doing a course in psychodynamic psychotherapy. With this small introduction, ma'am, I would like to welcome you on our platform, on your growth. Thank you so much to give your time with all of us.
Yes, thank you so much for having me. I think this is a wonderful initiative, and it's a very good platform where you can address a lot of issues relating to health and mental health, and I'm really glad to be part of this. And thank you for the introduction. So, like he's already mentioned, my name is Rachel Veronica, and today I'd like to address the topic. I'm going to quickly share my screen and I'll start. Can you, is my screen visible?
Yes, ma'am.
Yes. So, yeah, the topic that I've chosen is mind-body relationship, stress, and stress management. So, as soon as we, the minute I said mind-body relationship, I think everybody can understand what I'm talking about. We know that anything that we go through physically will affect you mentally, and anything that you go through mentally will affect you physically. So there's a relationship between your mind and your body, and it is it plays a very crucial role when it comes to your overall well-being, your health. Yeah, so I will be talking about that. So when I say health, so before going to mind body relationship, I'd like to talk about health. So when we talk about health, like let's say when someone asks you, or asks when you ask someone, how is your health? So we only think about it in terms of physical health. So when someone hears the question, how's your health, they're thinking about how they're doing physically, if they have maybe an illness or any physical symptom of any kind of illness. So they're thinking about physical symptoms. But health is not just your physical symptoms. So let me quickly. Yeah, so what is health? So according to the World Health Organization, health is defined as a complete state of physical, mental, and social well-being. And it's not just the absence of any disease or infirmity. So it's your overall well-being. So, and it's not just your physical well-being. So next time, let's say when someone asks you this question, how's your health? Or when you ask someone, it's, you have to think about it. It's not just my physical health, it's my mental health. So how am I doing mentally? How is my overall well-being as well? So it's very common for us to just think of health in terms of any kind of objective signs, that the body is not functioning properly, like high blood pressure, or any kind of subjective symptoms like any disease or pain or any kind of injury. So it's about time that we start looking at it like this. Consider your mental health, your overall well-being as well. So there's an entire branch of psychology that studies this health psychology, and it's dedicated to examine the psychological and social factors that can lead to a lot of illnesses, and how to prevent it, and the treatment of that illness. And it's dedicated to modifying a lot of health policies, and how to influence healthcare in general. So yeah, mind body connection and its importance. So like I said, mind body, there's a connection, there's a link between it. So what does it mean? Yeah, so the mind body connection is the link between a person's thoughts, attitudes and behaviors and their physical health. So I think we all know, we have an idea about this. I think by now, with the advancement and everything, I think by now we know that there is a relationship, and there are so many studies, so much evidence to back this up. And we have understood that emotions can affect our bodies, but we are now just beginning to understand how it actually influences health and longevity. So it's an important component of holistic medicine. I think most of us know what holistic medicine means. It's a healthcare philosophy. It seeks to treat the person as a whole, and not just their symptoms. It's a treatment for the person as a whole. So now more than ever, the all the doctors there, they seem to understand the importance of this approach. Not only the physical health, not only the body, but the mind and spirit as well. And it is the brain, your mind and your body. It's not a machine. Your brain is not a machine, operating separately from your body. They're both very connected. So there are so many studies, scientific studies. It keeps constantly revealing that all our hormones, neurotransmitters, which are the chemical messengers, they are associated with emotion and can have physical effects, like I mentioned, blood pressure, increase in heart rate, sleep patterns, and it can also affect our appetites. So yeah, the mind body connection of emotions and immunity. So there are a lot of research studies. Again, see, when I say research studies, I keep referring to them because it's not a theory. It's something that is backed up by scientific evidence. So it's there. It's a fact. So it supports a strong relationship between affective states and your immune system response. So let's say any kind of sustained negative emotional state, like stress, which we will be talking about. This stress, depression, anxiety, it can affect your immune system, and it can also affect your other bodily functions. And so there are people who are constantly under stress, or going through any kind of sustained negative emotional states. They tend to fall sick more often. So you can maybe sit down once in a while and check yourself. If you think you're falling sick more often, you have to see if this is something that is happening around, like with everybody falling sick as well, or is it only me? So if it's only you, and if you think you are constantly falling asleep sick, it could be cold, it could be the common flu, anything. And you have to sit and ask yourself, what's happening, how is it going, how is everything going in my life, what's happening in my life, is there something that is stressing me out? You should listen to your body at this time, and listen to your mind, what's it trying to tell you. And yeah, so this is something that all of us should start doing, because there are so many studies again that keep supporting, that keep saying that a lot of positive emotions, it can help reduce a lot of ill health symptoms, reducing pain, and it can increase longevity. And yeah, so can the mind heal the body? So is it possible? That again, there is a lot of research, especially in these three areas. There's meditation, there's mindfulness based psychotherapy, and there's hypnotherapy. So meditation, like we all know, we know what meditation is. There are so many studies again implicating that it's a training, the mind body training. It is associated with lower levels of stress and so many other positive emotions, and it can affect your body positively. And there has been a study that was conducted between two groups. So one group, it had people who are experienced meditators, and the other group not so much. And after the study, they found that people who meditate a lot, the experienced meditators, they have observed a lot of they saw lower levels of stress and the brain activity, the areas that was related to emotions. It was all under control, and when compared to the other group. And there is a type of meditation, it's called LKM. It's called loving kindness meditation. So it's a type of meditation that it's from the Buddhist traditions. So it aims at cultivating unconditional love and kindness, joy and compassion. It's not only for yourself but others as well. And it is also seen to effectively it's an effective intervention for increasing positive emotions, and it can also help in reducing pain. There's mindfulness-based psychotherapy. So mindfulness, it can be used as a therapeutic tool to develop awareness and acceptance of your feelings and of your thoughts, your bodily sensation, and aligning it to psychotherapy goals, which is reducing negative thoughts or developing self acceptance. So this can help with, it has proven to help with depression, pain, weight management, and disorders like schizophrenia, also smoking and anxiety, so etc. So these are the results when you go with mindfulness based psychotherapy. It can also have positive effects on your immune system and your brain functions. And then hypnotherapy. So according to APA is the American Psychological Association. So it defines hypnosis as a therapeutic method, and it's used in clinical settings where the client is induced into a state of relaxation by following suggestions from their psychotherapist. And it is in that state, in that relaxed state, in the subconscious mind, it can accept more readily suggestions to change involuntary responses. And it is useful for physical ailments, and such as managing pain and improving anxiety, depression, etc. And one type of hypnosis is gut directed hypnotherapy. It is shown to effectively reduce irritable bowel syndrome, its symptoms, and it increases overall well-being. So this was about the mind and body relationship, a small introduction about the link between the mind and the body. And now, yeah, moving on to stress. This is a very common thing that I think all of us go through. Stress. We're under a lot of stress most of the times, and this is something that needs to be addressed a lot, because we seem to just brush it off most of the time. When you just think that you can get over it, you can, it'll eventually pass and you can get over it, just brush it off, it's not a big deal. But it is a big deal, because we just saw how your mind and body is related, and anything that goes on here will affect your body. Even if the stress is temporary, let's say it's just a particular event or a situation that you're in that is very stressful, that can cause physical, it can impact your health in some way. Even if after the stressor is resolved, it will have some kind of impact on your health. So it is very important to address this and learn how to manage stress effectively. So what is stress? So it can be defined as any type of change that causes physical, emotional, or psychological strain. It's a bodily response to the demands of life. But there are also, like I said, emotional, mental aspects of stress, and it can be experienced as thoughts and feelings. So when you it's very hard to be under stress. It's a lot of load, it's a lot of mental load, and if there is no you can seek help, then it's not a sign of weakness. You can seek help when help manage your stress effectively. And all our mental health professionals, they help people reduce and manage their stress, and they can also help people work through other mental health issues. Like, if there's one thing that you're suffering from, if there's a lot of stress, you're in a constant state of stress, it will eventually lead to the development of other mental health issues. So what your mental health professional can do is they will also help you work through the other issues that develop while coping with high levels of stress over a period of time. So yeah, so it's very important to seek help when it's something like this. And stress is a response, it's a reaction to physical threat on one's life. It's a fight or flight response that causes, physical aspects of stress, and it happens when adrenaline and cortisol that is released into the bloodstream, and this can cause increased blood flow, clotting, and elevated heart rate, blood pressure, and blood sugar levels, and it is immediate and uncontrollable. So someone with high stress levels may experience these physical aspects that I mentioned earlier. They can experience these symptoms several times throughout the day. So consistently high levels of stress, it can cause people to develop conditions such as hypertension, stroke, diabetes, and chronic pain and heart attacks. So it's something very serious and needs to be addressed. So yeah, so some of the symptoms of stress, some common life stressors that can have a big impact on your health. It could be the death of a loved one, could be a divorce, loss of a job, increase in financial obligations, getting married, moving into a new home, chronic illness or injury, emotional problems like depression, anxiety, anger, grief, guilt, low self-esteem. And or it could be taking care of an elderly person or a sick family member, or other traumatic events, like natural disaster, theft, rape, or violence against you or a loved one. These are some of the common life stressors. But it also comes from within. So it could be fear, uncertainty about the future, could be attitudes and perceptions about your life, having unrealistic expectations of yourself, not adapting to change. Well, these stressors, it is more common in youth nowadays, because they're just starting out on life, and it is, the uncertainty about the future. It's something that can cause a lot of stress. So it has to start from here. Being able to manage and cope well with stress, it will help you in the long run. So these are some of the physical, mental, and emotional symptoms of stress. So physical symptoms can include headaches, insomnia, fatigue, stomach aches, body pain, acne or breakouts, digestive issues, and mental symptoms: anxiety, depression, suicidal ideation, food and eating issues, addictions and or compulsions, the substance abuse. Then emotional symptoms: irritability, sadness, anger, apathy, overwhelming, feeling very overwhelmed. Yeah, so those are some of the symptoms and causes. Yeah, so how to manage stress. So before going into the management of stress, uh, let's talk about the importance of managing stress. So if you're living with high levels of stress, you're putting your entire well-being at risk. So it can cause havoc on your emotional states, emotional, there's no balance, there's emotional equilibrium, and your physical health. So it also affects your ability to think clearly, function effectively, and also enjoy life. And it can seem like there's nothing you can do about stress. Responsibilities will keep coming, it's constant, it's there, and your bills, it'll keep coming, and it's always demanding your work life responsibilities, your there are a lot of other things that you think you know you can't do anything about, but you have a lot more control than you think you do. So managing your stress effectively, it helps you to break the hold that stress has on your life, so you can be happier, you can be healthier and more productive, and because the ultimate goal is a balanced life. So balanced life means having time for work, relationships, relaxation, and you also need to develop resilience to hold up under pressure, because the more you try to manage, the more you'll learn to build up resilience, and you'll be able to hold yourself under pressure, and you'll be able to meet the challenges more effectively. But the thing is, it's not one size fits all. Like, it's easy to say all these things, and you might even try managing stress, but sometimes it's fits all. You have to experiment, you have to find out what works best for you. It's like other things, we know that everybody is different, and things work stress management as well. It's not one size fits all, and you need to explore, you need to experiment, and find out what works best for you. So there are some, you could say, tips to manage stress. So the first one is start with identifying the sources of stress, what's going on in your life, because what is causing this. So it's easy sometimes, to identify major stressors, like some saw a few stressors, like new job, maybe moving to a different place, or going through a divorce. These are very obvious, but there are other stressors that can be very complicated to trace back. It's very easy to overlook our own thoughts and feelings and behaviors that can contribute to your everyday stress level. So it's very important to sit down and see where this is coming from. And how do you identify your sources of stress? Because you have to look at your habits, you'll have to look at your attitude and how do you explain your stress? Do you think it is something temporary? You keep telling yourself, there's a lot of things going on right now, and it'll eventually, I'll eventually get over it, it'll get over in no time. Or do you define it as part of your personality? Maybe things are always like this for me. It's a part of my life, this is how I am, I'm always stressing. Is that how you define stress, or do you blame it on other people or outside events, and maybe think of it as completely normal? So you can answer these questions when you introspect, when you sit down and uh, trace back and see where this is coming from, and you'll have to take responsibility for the role you play in creating the stress, or in maintaining your stress level. um, you know until you do that, it will remain outside your control. So what you can do is start a stress journal. I'm pretty sure this is something, that we keep hearing a lot. Maintain a journal, have a journal, write down your thoughts. It's easier for you to express yourself when you're putting it down. So we've heard this a lot, and the reason we keep hearing this a lot is because it actually works. So starting a stress journal, it can help you to identify the regular stressors in your life and the way you deal with them. It's just making a note of everything that's going on. So each time you feel stressed, you can keep a track of it in your journal, or you can maybe install some app. There are a lot of apps for these things. You can track your stress, just immediately put it down, type it down, and keep a log that'll help you see patterns, and what exactly is causing, you can answer these questions. It could be what caused your stress. If you're not sure of what exactly caused your stress, you can take a guess. You could guess and you can note it down. And then how did you feel, both mentally and physically? Yeah, but how did you feel when that happened, and how did you react to it? What was your response? That's the third one. And the fourth one is, what did you do to make yourself feel better? This is something we keep skipping a lot. We just don't do anything to make ourselves feel better. And it's very important to address all the four questions, write it down, and follow. You'll be able to figure out a pattern. And the more you practice this, it comes as a reflex for you eventually. You keep practicing it'll be your instinct. Your first instinct to do is to trace, identify the source, um, think about how you reacted to it, how you felt physically and emotionally, and you can act accordingly. Do something to make yourself feel better. So the next one is practicing the 4 A's of stress management. So like we already discussed, while stress, it's an automatic response, right? It's from your nervous system. It's an automatic response. And sometimes it's predictable. Like, for example, maybe a meeting that you have that day, or any kind of family gathering. These are some of the examples. And when handling such predictable stressors, you can either change the situation or change the reaction. So when deciding which option to choose, it's it's helpful to think about these 4 A's. It's avoid, alter, adapt, and accept. So the first one is avoid unnecessary stress. So it's not healthy to avoid a stressful situation that needs to be addressed, but there are a number of stressors in your life that you can eliminate without getting a second thought. It's very easy to do that. I mean, it's easy to say, of course, but there are a lot of chances where you can do that. And the first thing, it starts with saying no. One has to learn how to say no. This is something I personally struggle with as well. So learning to say no, you have to know your limits, and stick to them. It doesn't matter if it's in your professional or personal life. Taking on more than you can handle, it's a recipe for stress. And see, a lot of when I say this, I probably hear back saying there are some things that I can't say no to, especially in your professional life. There maybe a project or maybe extra workload for the day that was given to you by your superior, and you can't say no to that. Shoulds, the musts, and if possible, say no to taking on too much. There are something that you can avoid. So when you can avoid, you can do it. And the next one is avoiding people who stress you out. So if there's someone that's consistently causing stress in your life, just limit the amount of time you spend with that person, or end the relationship. Sometimes it could be in your own house, and it's not easy to cut them off. Obviously, you can't cut off family. So what you can do is you have to prioritize your mental health, and you'll have to take control of your environment, and try to limit the amount of time you spend with that person. And taking control of your environment, like I said, if anything that you think will make you anxious or will give you stress or make you very tense, just avoid it. like let's say um, if traffic, let's say, makes you tense while traveling, if traffic makes you tense, you could take a longer but less traveled road. If something that is out of your control, if some situation or event is going to stress you out and you can't do anything about it, so you'll have to go with the alternative. If you have another choice, go with it. So you have to take control of your own environment, and you'll have to make a to-do list. The next one is making your own to-do list. It's analyzing your schedule, your responsibilities, and your daily tasks. And if you have a lot on your plate, just you could maybe drop the tasks that aren't that not truly necessary. You could just put them at the bottom or take them off the list completely. The second is altering the situation. So if you can't avoid a stressful situation, you can always alter it. So it often involves changing the way you communicate and operate in your daily life. It could, first thing you could start off by doing is expressing your feelings instead of bottling them up. This is, I know, very hard to do, but it's here because it works. So if someone or something is bothering you, be more assertive and communicate your concerns you don't have to be rude. You could be in a respectful manner, because you're just communicating what is bothering you. It's your concern and you can do it. It's not wrong. You can do it. And communication is very important. This is something that we hear, read everywhere. Communication is important. If you don't communicate, you will start resenting them. Okay, there's a build-up of resentment, and with that, your stress will increase. So expressing your feelings instead of bottling them up, communicating with the other person will help relieve stress. And we should also be willing to compromise, because when we are asking another person to do something to change their behavior, we should also be willing to do the same. And because when we see someone as causing you stress, most of the times we shouldn't eliminate the possibility that you can also indirectly cause someone stress. So you'll have to be willing to compromise, when you'll have to change your own behavior as well if you ask someone else to do that. So just finding a middle ground, finding a happy middle ground could solve a lot of issues. And then creating a balanced schedule. So all work and no time for yourself, it's again a recipe for burnout. So you'll have to find a balance between your work and family life and social activities or anything, any daily responsibilities and downtime. There has to be a balance. So the next is adapting to the stressor. So if you can't change the stressor again, you'd have to change yourself. You can adapt to stressful situations, and regain your sense of control by changing your expectations and attitudes. It could be, the first one could be reframing problems. Try to view your stressful situations from a more positive perspective. And this is something, again, very hard to do, because let's say, for example, again, let's take the traffic jam example. So you're stuck in traffic and there's nothing you can do about it, and it's just making you really mad, and it's something you can't control. So you will have to adapt to it, change the way you look at it. You can look at it as an opportunity to maybe pause, regroup, and listen to your favorite song or enjoy some time alone. Because there's no point in just sitting there and being mad about the entire situation. What you can do is adapt to the situation and look at it in a more positive perspective, which will reduce your stress levels. The next one is looking at the bigger picture. So looking at the bigger picture, this applies even before for all of this, actually everything that you want to apply. If you to manage your stress effectively, you'll have to start looking at the bigger picture. How is this going to affect me in the long run? How you'll have to find it in yourself to start doing this. It's very hard. Reading about it, listening about it, watching videos about it, it's all very easy to do, but doing it is something that is very hard. So you have to look at the big picture. Are you willing to be like this, live like this always, or are you willing to make a change? So looking at the bigger picture is very important. And here you have to, take the perspective of a stressful situation, and you can ask yourself how important it will be in the long run. Will it matter in a month, or is it really worth getting upset over? If the answer is no, you can focus your energy and time elsewhere. It's going to be very hard in the beginning to do this, but if you keep practicing, it will become your reflex. You'll automatically do this. So the next one is adjusting your standards. Perfectionism is a major source of avoidable stress. This is something, one of my variables that I'm studying in my current research. So see, perfectionism, it's causes it's a major source of avoidable stress, and you have to stop setting yourself up for failure by demanding perfectionism. Set reasonable standards for yourself and others. And the next one is practicing gratitude. So when stress is getting you down, you can take a moment to reflect on all the things that you appreciate in your life. This is um, it could be your own positive qualities and gifts. Appreciate yourself, take a moment to reflect on everything that has happened, that everything you have. It's a simple strategy that can help you keep things in perspective. So the last A is accepting the things you can't change. So some sources of stress are unavoidable, and you can't prevent or change stressors, like death of a loved one, or a serious illness, or something like that. So in these cases, the best way to cope with stress is to accept things as they are. It can be very difficult, but in the long run, it's easier than just railing against the situation you can't change. So you don't have to, don't try to control the uncontrollable. Many things in life are beyond our control. Particularly the behavior of other people. This is something that I also should listen to. I have to take my own advice here. It's rather than stressing out over them, you could focus on the things you can control, like the way you choose to respond to their behavior or react to their problem. There's nothing much you can do about their behavior, but what you can do is control your own behavior and choose to react in a particular way that will avoid you from stressing out too much. And the next one is looking for the upside. Look for the upside when facing challenges, major challenges. You can look at them as opportunities for personal growth. So if your own choices, if your own actions have contributed to a stressful situation, you can reflect on them, and you can learn from your own mistakes. And the next one is learning to forgive. Accepting the fact that we live in an imperfect world and that people do make mistakes. You have to learn to let go of anger and resentments, and you have to free yourself from that burden. Just forgive, and moving on is something that we can do. And the next one is sharing your feelings. Again, expressing what you're going through. It could be very cathartic, and even if it's there's nothing you can do after the stressful situation, talking can help. Talking to a friend, or you can make an appointment with a therapist always. So the next one is get moving. You don't have to, when you're stressed, the last thing you want to do is get out, get up and exercise. But physical activity, it's a huge stress reliever, and you don't have to be an athlete or anything to, experience these benefits. It can release endorphins that can make you feel good, and it can also be a distraction from all your daily worries. And you could include some of these exercises into your daily schedule. You could put on some music, dance around, take your pet for a walk, or you could walk or cycle to the stores. You could take the stairs instead of the elevator. You could have an exercise partner, could play a lot of games. So you'll have to get moving. And yeah, the next one is connect to others. So this is something that is very calming, spending quality time with another human being who makes you feel very safe and comfortable and understood. So it triggers, face-to-face interaction triggers hormones that can counteract the body's defensive fight or flight response. So it's a natural stress reliever, and I can personally vouch for this because I do this sometimes. Just calling up, our group of friends, we have a video call. They don't live in the same country, and when I do this, I don't realize it in the moment, but after it's over, it's very calming and very relieving. So it's something that you should definitely do. You know. Next one, making time for fun and relaxation. You could have some time, have some me time. Don't get just caught up with the hustle and bustle of life that you forget to take care of yourself. It's nurturing yourself. It's not a luxury. It's a necessity. So it's very important, and you have to make time regularly for yourself, and you'll be in a better place to handle life's stressors when you do this. You could set aside some leisure time. You could do something you enjoy every day. You could take up a relaxation practice, just rest, take some time off, just take a nap, break from all your responsibilities. You could make time to do something that you like, brings you joy. It could be anything. It could be playing an instrument or just going out for a walk. It could be anything. Manage your time better. This is something very important. This is literally the basis for everything. Even if you want to implement everything that we spoke about, to sit down and to think about it, to plan a schedule, you'll have to learn how to manage your time better, because poor time management can cause a lot of stress. So when you'll just when there's too much, when you're not able to manage your tasks, you'll be tempted to just cut out the things that you should do, like your healthy things, basically that should be keeping you in check, like socializing or getting enough sleep. So it is very important to manage your time to have a better work life, healthier work life balance. You can start off by not overcommitting yourself. Avoid scheduling things back to back, or just trying to fit in too much into one day. Or prioritizing tasks. You could make a list of tasks that you have to do, and you could tackle them in the order of its importance. Do the most important things first, or things that gives you that you don't feel good about. Let's say it's very stressful and you want to get it over with, so do that first, and then you could do the tasks that are least important in the end, and the rest of your day will be more pleasant as a result of this. The next thing you can do is delegate responsibility. You don't have to do everything by yourself. Let it be at home or work, or anywhere else. If there are people that can take care of the task, you should let them, and you should let go of the desire to control and oversee every little step. So you'll be going through unnecessary stress in the process. So the next one is maintain balance with a healthy lifestyle. So exercising is a one way, and there are other healthy diet. You could reduce caffeine and sugar, because I think the minute you hear this, it's like, aha, there's no way you could do this. But it's only temporary high. It gives you only a temporary high, and at the end, it'll just put you in a very bad mood. By reducing the amount of coffee, chocolates, and sugar snacks in your diet, you'll feel more relaxed and you'll be able to sleep better. The next one is avoiding alcohol, cigarettes, and drugs. Self-medicating with these things, with alcohol or drugs, could provide an easy escape from stress, but it's only temporary. So let's not avoid or mask the issue at hand and deal with problems in this way. Let's do it with a clear mind. And the last one is getting enough sleep. Sleep is very important. In the moment stress, there are many ways you could do that. Again, traffic example, if you're stuck there, or if in a stressful meeting, or you just had an argument with your friend or your family member, you need to find a way to manage it right there. And you could do this by taking deep breath, using your senses, what you can hear, see, taste, or think of something that you really like, or view a favorite picture on your phone, and you focus on yourself again. Fits all. It's not everyone responds to the same thing. Hi, should I continue? Yes, so this is the last slide. We spoke about how to effectively manage stress. Um, there are treatment options for stress therapy as well. So why exactly do we seek therapy for stress? It's because stress is something that everyone experiences, and many people believe that they should be able to cope with it on their own. But for some people, they need more assistance, and um, professional help can be beneficial in providing an outlet for for you, and you'll be able to talk about your stress. You'll be able to learn to identify the main causes of stress in your life, and you'll be able to learn how to incorporate the tools for reducing stress daily. And some of the treatment options for stress therapy is the first one is psychotherapy. So this type of therapy, it takes place with a psychologist or a psychiatrist or another type of mental health professional. And in this, people are encouraged to discover the underlying causes for their stress, so that they can learn strategies and improve their quality of life. There's behavior therapy. There are several types of behavioral therapy. There's CBT, which is cognitive behavioral therapy, and it is one of the most beneficial ways to deal with stress. And here, people are taught to recognize and change their negative thought patterns and apply different tools which can help them improve their negative self-talk to be more positive. And this means people can learn to be um, less hard on themselves, and to recognize that it's okay to reduce some of their burdens without seeing themselves as a failure. And alternative therapies. So in addition to traditional methods of stress therapy, there are many activities that one can do to help reduce their stress levels, like exercise, yoga, massage, meditation, which we already spoke about, and social support. These are all useful tools. And if a person is faced with uh, intense feelings of stress or pressure, these are some of the treatment options that can help with stress. So that is it. Thank you so much for listening. Yeah, so the questions. So the first question, how was the treatment? How do you treat, okay, PTSD? Yes, yeah. So I'm still studying to be a counseling uh, psychologist, and as of now, I am not yet authorized to, treat patients with PTSD. It can't prescribe medication, but what we have been taught is that CBT is it's a type of psychotherapy that we just spoke about. It's been found to be most effective in treating PTSD, both in short term and long term, and it's trauma focused, meaning that the traumatic event or whatever that had caused the patient to develop PTSD, they are the center of the treatment, and they work on it. and it helps the patient deal with anxiety that comes with. Yeah. What's the second question? How do you counsel someone with ASD, that is autism spectrum disorder? So here there is no cure, first thing, that exists for ASD, and there is no one size fits all treatment. So the goal of the treatment is to maximize the ability to function by reducing symptoms and by and supporting development and learning. So there are a range of home-based and school-based treatments that can be used. As interventions. It can be overwhelming, but it works. Options may include behavior and communication therapies. There's educational therapies, family therapies. There are other therapies. There are medications as well. No medication can improve the core signs of autism spectrum disorder, but it can help control some of the symptoms.